South Africa faces a growing burden of infectious and non-communicable diseases. At the same time, we need to better understand the interaction between these two. Researchers and clinicians are increasingly generating complex data sets to understand this, and these include complex omics data sets, image data, etc. And these need to be integrated with clinical and environmental and many other data types to create a more complete picture of health and disease. Artificial intelligence methods are well placed to identify novel patterns and connections in these complex data sets. And this can support rapid and accurate diagnosis, disease prediction, and clinical decision-making. Therefore, there's an important and urgent need to embrace AI to curate, integrate, and interpret biomedical data for clinical decision support, and to ensure that the data are converted into real outcomes for patients. This is the challenge that the AI for African Population Health Research Unit, AIPHU, is going to address. Artificial intelligence in health is currently failing African populations because of the scarcity of relevant local data and the skills needed to apply data science techniques to the datasets that do exist. So the time is ripe to address these inequities and access to improved opportunities in health that artificial intelligence and data science can offer. Data generation opportunities have accelerated, and at the same time, our group has built skills in data science through a number of new training programs. This is creating a generation of data analysts who are ready and ripe to apply their skills to biomedical data. There's also a global push to integrate heterogeneous data sets to address pressing health challenges, and South Africa should really not be left behind in this. We need to derive value from African data to address our increasing health burden. So the AI for African Population Health Unit is going to integrate omics datasets, biomedical imaging, and artificial intelligence, including machine learning, to address these major health challenges that affect South Africa, but also the rest of the continent. So this will be achieved through AI-powered precision medicine, multimodal AI-driven diagnostics, and the development of Torch Africa. This is a collection of PyTorch-based packages built from African biomedical data to enhance transfer learning in African AI and machine learning studies. The unit will offer AI solutions for study of non-communicable diseases, including cancer and cardiovascular diseases, as well as infectious diseases such as HIV/AIDS and tuberculosis. Most importantly, our work is going to focus on the connection and the interface between these two, between non-communicable and infectious diseases. So through this work, our unit, the AIPHU, aims to help transform complex biomedical data into knowledge that can better support diagnosis, disease risk prediction, and better clinical decision-making. So our goal is not simply to generate data, but ensure that the data that are generated are used to improve health outcomes for patients and populations. I'd like to thank the South African Medical Research Council for recognizing the potential of AI for health impact. I also thank the SAMRC for investing in our future biomedical AI specialists who are going to follow interdisciplinary approaches to healthcare by integrating data derived from multiple sources that together inform clinical decision-making. Support from the SAMRC will be instrumental in building this interdisciplinary unit and enabling capacity development in this important field. Together, we have the opportunity to ensure that African data, African expertise, and African innovation contribute meaningfully to the future of precision medicine, population health, and equitable healthcare across the continent.